but also for those of you who are doubters, and if you have a doctor who's a doubter, maybe they'll look at it. This was made with the time of the book. It's a professional video company. They went to 4 of the families that were on my waiting list. They went to their homes before they came to see me. They videoed them, the child and the families. Then they came with them on the first visit. They came a month later for a follow-up, and they came close to a year later, and it's peppered with interviews from various experts. And in less than 1 year, you see the profound effects of these 4 kids. One of them is fully recovered about 6 months later, and the other 3 are actually way on their way. I would never know that. You don't know. You're not always successful with every kid. But it just shows the power of this therapy, and it's shown. It's actually. And lastly, I want to tell you, INSEPT is this. You heard about Dan. Dan, Defeat Autism Now, is really. We are trying. I've been requested to create this physician organization called INSEPT, which stands for the International College for Excellence in Pediatric Therapeutics. This is a physician organization. All the doctors here are going to need to join this, because this is the organization that's going to try to raise the standard of care, level the bar for the care, because there's a lot of people, unfortunately, that have gone to one Dan conference and say, I'm a Dan doctor, quote, and are not really doing what they need to do. Parents are spending a lot of money getting inferior care. So this is going to be much more rigorous training. There'll be a lot over the internet for the international physicians, as well as, but you know, to be an INSEPT physician will be, it'll require maintenance certification and things. But it will help to ensure the doctor is up to date and ensure parents that at least, we can't know what's going to go on in the office, but at least we know that they've attained certain proficiency. There's going to be certification, and credential. This is my next large project. This is probably going to be one of the largest things I ever do. And again, this is really lastly, that one of the things about healing the kids, for me, it's very, very hard work. It's very complex. We get probably at least 60 calls a day from parents because of the complexity of what goes on with questions. So you have to have a big staff. It's not easy to do. However, it is incredibly gratifying. This is a family where these 2 were autistic, they're now recovered. What about the 3rd kid who gets short shrift because basically so much energy is putting into recovering the other 2? And I've had kids have to go to therapy because they really have been in some way neglected, not on purpose, but, and what about the spouses and the relationship problems? And what about the grandparents and the brothers and uncle and aunts? When you heal these kids, you really do heal the families. And that is one of the most amazing opportunities that I've had in dealing with way over 2,000 kids that I get to deal with and helping kids all over the world. Anyway, thank you very much for your attention.
Actually, we're going to do this at the very end, but Dr. Bock just mentioned book and mentioned recovery. The hardest thing for us to do is to get families whose kids, I know you've been told that this is not recoverable. And the hardest thing to do is to get families, especially here in Singapore, to stand up there and say, you know what, I had good luck. So everybody moves away. They hear about recovery, but they never see it. I hope that next year when we do this again, we will see more kids up here. But we had one family that was willing to stand up here and show you their child. Donna?
Ready? How are you? Good. What's your name? You're not going to tell me, are you?
What's your name?
You didn't want to say it either.
Thank you so much, Dr. Bock. When I went to my first Dan conference and I got your book, I went to my doctor and I brought the book and I said, look, this is what we want to do. This is our roadmap. And 6 months later, my son was recovered.
Wow.
Thank you is not enough, so we have a small token to say thank you. Yes, please stand.
Oh, wow. You say what it is.
Turn it over. That is a picture of my son, of our son.
Sebastian?
Sebastian Schmidt, recovered 2008. There's one other person I would like to say thank you. I don't know if everybody here knows what kind of sacrifice he has made to the autism community. He is also a parent of a recovered child, and instead of saying, this is history and I'm just going to move on with my life. He is making a difference. He's one of the few people I know that has combined ABA with biomedical intervention, and I would just like to say thank you to him as well. Do you know if you would come up here, I would Thank you so much.
I actually didn't expect it.
But he doesn't expect it, but this is a man who works tirelessly for your children, and really, you deserve every single bit of gratitude. Thank you. This was not, by the way, this was not rehearsed. We didn't know this was happening, just so you know.
Okay, we got any questions?
And just so you know, I mean, the one thing that I want you to, from a, oh, I mean, I have this. One thing that I want you to know from a practical perspective is it always is great when you see recovered kids because it's real, and we're recovering more and more kids. People always ask me for the percentage. I don't have it, but I can say that more and more are recovering. The best day I ever had was seeing 3 kids on one day who had recovered. It was an amazing day for me. I mean, that's gratitude for me. It's amazing. But you don't let it depress you that your kid's not recovered. Okay? It's a long path, takes different lengths of time, and not every kid recovers. But what I really want you to know, especially it's a cultural thing, and I saw someone who I felt really, this kid had improved from what I had heard, and wasn't appreciating the improvement because he wasn't recovered. And appreciate all the improvements. Love your kid where they are, I know you do, but recognize that recovery is the goal, but if you don't, if the kid doesn't recover or it takes longer than you think, it's okay. There needs to be a lot of acceptance and forgiveness here. Persistence, determination, very important. But you need to appreciate the improvement, because I see sometimes parents, their kids are so much better, but they're not recovered. And they say, oh, but that kid's recovered. And it's like, it's, you know, it's laughable, but it's sad. It's sad. So you need to know that, okay? I know how much everybody wants their kid recovered yesterday. Right? I know that. Okay. All right, questions? Yeah.
Thanks very much for the presentation, very, very useful. One question I had, we saw some pictures of various parts of the child's body that was inflamed, and you also talked about various deficiencies in terms of nutrients in the body and so on. What tests do you do when you first get a child in your doctor's office?
Well, okay, that's a good question. I know that I started to mention that, so perfect, thanks. And I have the slides, but it would take me, I'm not going to take the time to go back to that slide. But you have to do regular blood counts. You do a CBC, you do chem profiles, liver, kidney, you make sure all that stuff is okay, because especially if you have to use the medications. We look at metabolics a lot. So we look at oxidative stress, we look at glutathione, lipid peroxide is a measure of oxidative stress. We look at sulfate and cysteine, some of the things that may be low. We look at various fat-soluble vitamins, which may be low, vitamin D, vitamin A. We look at a number of the minerals in whole blood or in the cells, and heavy metals in the blood, but that's usually it's not often elevated in the blood. Sometimes it is, especially in Hong Kong, or the kids who are eating a ton of fish. Yeah.
Is this all through blood tests or hair tests?
It's through blood tests. For us, we do mostly blood tests. We look at the stool because we want to make sure there's no imbalance in the intestinal flora. We look at, you can look at digestion if they're maldigesting in the stool, if there's inflammatory markers, there's yeast. We look at organic acids, which are metabolic, show metabolic imbalances, can suggest mitochondrial problems, can suggest detox problems. And these are blood or urine organic acids, blood, urine, and stool. Some people look at hair analysis. Hair analysis, maybe it can include an overall toxicity. Remember, these kids have an efflux disorder, so one of the studies showed that the kids with the most severe autism had the lowest baby hair mercury, because They have an efflux disorder. They couldn't get rid of it. So you would have thought it would be the opposite way because they're toxic. Okay? So these are the kind of things you need to do. What I would say, caveat, again, I don't think you should get tests by yourself without working with a physician or practitioner knowledgeable in this field, because we've had a lab, I won't give any names, that was doing that in kids. And then you see the parents, and they get all these expensive blood work. They have no clue what to do with it. And I think that's unconscionable. When we are taught when you get a blood test, the result of that blood test should have you do something either way. If it's not going to change what you do, sometimes you do it confirmatory, like sometimes you treat clinically, but you need a confirmatory blood test. But for the most part, you want to have a blood test that leads you, you're asking a question, it's going to help you answer it. So I don't think parents should go out and just get tons of blood tests without working with a practitioner or physician that is knowledgeable in this field. I really don't.
Next, please.
What? I think there are some, I'm not going to give any names. I think people should probably talk to Dino maybe about resources and stuff like that. I mean, I'm not going to give any names and things like that. But I think that, Dino's a very good, valuable person who knows resources.
Next question.
Hi. Yeah, I started my child on biomedical some time back, but I have to stop because he's very picky. He's very orally sensitive. So I wonder how do I overcome it if I really want to implement it?
Well, I think sometimes there are biomedical ways to help that. It depends on what his profile. I'd have to see his profile. But there are also OT. Sometimes the sensory integration therapies can really help that stuff. You can really focus on that. So that would be a focus, because that is one of the problems, is actually, I can tell you to do all these things, but implementing it is a trick. Trust me, it's not always easy. So, but you shouldn't give up, because there are ways to help that. Not just biomedical. That's where you may use the behavioral and the occupational therapies, and then maybe reintegrate the biomedical. Okay.
Hi. My son looks like the picture of that skinny white boy with the big tummy. Could you just quickly go over what are some of the things that would indicate to you?
Oh, that would indicate to me an inflamed gut. So I would send that kind of a kid to a pediatric gastroenterologist to get scoped. Okay, colonoscope, maybe upper as well, but certainly colonoscope, probably both, because you need to treat the inflammation. They probably have a leaky gut, maldigestion, malabsorption, so they're probably nutrient deficient. Those are the kind of things that I would think about. And but that is a classic example of, I don't think that kid was complaining of pain. They don't always have pain with inflammation. So that's why if you see that kind of picture, you have to assume the child is malabsorbing. You can give them enzymes, but what I hear also is enzymes can be helpful in a subset of kids, help them absorb properly, but I hear from some that enzymes are overutilized, especially around here, and that enzymes are not the answer, like, oh, I don't have to do the gluten-free casein, but I can just do enzymes. That's not really true. You look to shortcut it, but unfortunately, this is not a shortcutting kind of deal. This is the real long-haul, tough deal, unfortunately.
Question out here?
Yeah.
Yes, thank you for the presentation. Actually, I have two questions, but let's take it one by one. First one is regarding, we are in this process of biomedication, but listening to you, to your fellow colleagues, but also to different parents, all of them are saying that biomedication works. So if it is that obvious, why all the doctors, general pediatricians and psychiatrists are refusing that?